Accha Sneha is one of the most important Purva Karma procedures in Panchakarma. It is an internal evolution therapy in which pure Sneha such as Gruta or Taila is administered before Shodhana procedures. Presentation, I will discuss its definition, classical references, indications, dosage, procedures, physiological basis, clinical application, and recent scientific concepts related to bile metabolism. Introduction. To understand Accha Sneha, let us first understand the concept of Sneha. The word Sneha literally means oiliness, unctuousness, love, and nourishment. In Ayurveda, Sneha is used not only to lubricate the body but also to nourish the tissues and prepare the body for purification therapies. Depending upon the method of administration, Sneha is divided into two types. The first is Accha Sneha, where pure Sneha is administered alone. The second is Sharaka Sneha, where Sneha is administered along with food or other supporting substances. Among these two, Accha Sneha is considered more effective because pure Sneha acts directly and rapidly without interference from food. This makes it the preferred method before Shodhana Karma. Definition. Accha Sneha means the administration of pure Kruta or Taila on an empty stomach without mixing it with any food or medicine. It is mainly performed before Umana and Virechana. The objective is to loosen and liquefy the accumulated doshas. Once the doshas become mobile, they move from peripheral tissues known as shaka into the gastrointestinal tract called Koshtha. This movement makes their elimination through Panchakarma much easier and more effective. Therefore, Accha Sneha plays a vital role in the success of Shodhana therapy. According to different acharyas, according to Charaka Samhita, Accha Sneha is considered the Pratama Kalpana, meaning the primary or original form of Sneha administration. It is different from Pravicharana because it is administered in its pure form. The shloka goes like this. Achchapeyastu yaha sneho na tamhur vicharanam snehasya sa bishaktustaha kalpaha pratama kalpikaha. This emphasizes the importance of Accha Sneha in classical Ayurveda. According to According to Acharya Sushruta, Accha Sneha should be administered only after proper patient selection. It is suitable for individuals who are accustomed to consuming Sneha and who possesses good physical strength. It should preferably be administered during moderate climate conditions. Very hot or extremely cold weather should be avoided because these conditions may interfere with digestion and metabolism. Sushruta also praises Accha Sneha as the best method of internal evolution because of its excellent therapeutic effects. The shloka goes like this. Sneha saptyaha kleshasaha kale na ati ushna shitale achameva pibet sneha Achchapanam hi pujitam. This verse relates the importance of selecting the right patient, the proper season, and the correct method of administration. According to Acharya Vagbhata, Accha Sneha is considered the Shrestha Kalpa, meaning the best formulation of Sneha. The reason is that it produces rapid Snehana Karma. Because pure Sneha is administered without any other substances, it acts more efficiently. This enables quicker preparation of the patient for Shodhana procedures. This concept demonstrates why Accha Sneha is preferred whenever strong internal evolution is required. The shloka emphasized both the purity and the effectiveness of these procedures. Finally, according to Acharya Kashyapa, Accha Sneha is classified into three dosage patterns. The first is Rasva Matra, which gets digested within approximately 6 hours. The second is Madhyama Matra, which is digested within about 12 hours. The third is Mahati Matra, which requires nearly 24 hours for complete digestion. This classification helps physicians select the appropriate dose according to the patient's digestive power, strength, disease condition, and therapeutic requirement. Thus, proper dose selection is one of the most important factors for achieving successful Snehana. Next, let us discuss the commonly used Sneha Dravyas. The choice of Sneha is not the same for every patient. It depends on the dosha involved, the disease, the patient's prakriti, Agni, and physician's clinical judgment. The most commonly used Sneha is Gogruta or cow's ghee. It is considered the best because it balances Pitta and Vata, nourishes all the dhatus, improves memory, and has rasayana properties. Tila Taila or sesame oil is mainly indicated for Vata disorders because it is warm, penetrating, and deeply nourishing. Eranda Taila is selected in certain conditions, especially when Virechana is planned due to its strong purgative action. Apart from these, medicated grutas such as Mahatiktaka Gruta and Panchatiktaka Gruta are selected according to the disease condition. Therefore, selecting the correct Sneha is an important step for achieving success. Why is Accha Sneha done? Now the question arises, why do we perform Accha Sneha? The primary aim is dosha utkleshana, which means loosening and liquefying the vitiated doshas. Normally, doshas remain lodged deep within the tissues. If Shodhana is performed directly, complete elimination may not occur. Accha Sneha mobilizes these doshas and brings them from Shaka, the peripheral tissues, to Koshtha, the gastrointestinal tract. It also helps in Soto Shodhana by loosening toxins attached to the channels of the body. As a result, Vamana or Virechana becomes more effective and procedures better therapeutic outcomes. In simple words, Accha Sneha prepares the body for purification. The duration of Accha Sneha generally ranges from 3 to 7 days. However, the duration is not fixed for every patient. It depends on several important factors such as Agni, Koshtha, Rogapala, and the type of Sneha administered. Patients with Mrudu Koshtha usually require around 3 days. Patients with Madhyama Koshtha generally require 5 days. Those with Ghura Koshtha may need up to 7 days. Therefore, the duration should always be individualized according to the patient's condition. Now let us understand the dosage. The dose is usually administered in an Arohana Matra or gradually increasing pattern. On the first day, a Hrusva Matra is given. Depending on the digestion of the previous day's dose, the quantity is increased gradually on the following days. The Sneha is administered early in the morning on an empty stomach after confirming that the previous meal has been completely digested. Increasing the dose gradually allows the digestive system to adapt and helps achieve proper internal oleation without causing complications. Methods of administration. The procedure begins on the previous night and the patient is advised to take a light and easily digestible meal. The next morning, after confirming complete digestion of the previous meal, lukewarm Sneha is administered on an empty stomach. After taking Sneha, the patient should avoid food until the Sneha is completely digested. Warm water may be given if required to facilitate digestion. During this period, the patient should avoid sleeping during the day, strenuous exercise, exposure to cold and heavy meals. Monitoring throughout the procedure is very important to identify the appearance of Sneha Jirna Lakshanas. Sneha Jirna Lakshanas. How do we know that the Sneha has been digested properly? This is assessed by observing the Sneha Jirna Lakshanas. The first sign is the return of natural hunger. The patient experiences lightness of the body. There is clear belching without the taste or smell of Sneha. Most importantly, there is no nausea or heaviness. These signs indicate that digestion is complete and the patient is ready for the next dose or the next stage of treatment. Recognizing these lakshanas correctly is essential for safe and effective management. Samyak Snigdha Lakshanas. After repeated administration of Sneha, the physician looks for Samyak Snigdha Lakshanas, which indicate adequate oleation. These include Vatanulomana, meaning proper downward movement of Vata. The stool becomes soft and oily, the skin becomes soft and smooth, the patient feels lightness and comfort. There is aversion to Sneha, indicating that the body has received sufficient unctuousness. These are the desired therapeutic signs showing that the patient is ready for Shodhana therapy. Asamyak and Atisnigdha Lakshanas. If Sneha administered is insufficient, Asamyak Snigdha Lakshanas appear. These include persistent dryness of the skin, hard stools, lack of softness, and absence of aversion to Sneha. On the other hand, if Sneha is administered in excess, Atisnigdha Lakshanas develop. These include excessive salivation, nausea, heaviness of the body, diarrhea, laziness, and loss of appetite. Therefore, it is a physician's responsibility to identify these signs early and decide whether to continue, stop, or modify the treatment. This completes the procedure and assessment of Accha Sneha. Now, I would like to present a clinical case to demonstrate the practical application of Accha Sneha. This case is of a 28-year-old female working as an office employee. She belonged to Pitta Vata Prakriti with Madhyama Koshtha and Tikshna but irregular Agni. The patient's socio-economic status was middle class and there was no significant past medical history. Based on her Prakriti and clinical condition, she was considered suitable for Shodhana therapy after proper Purvakarma. If complaints, the patient presented with the following complaints. She had recurrent red and itchy skin eruptions for the past 8 months. She also complained of burning sensation over the affected areas. Along with this, she experienced occasional constipation and irritability, suggesting the involvement of aggravated Pitta dosha associated with Vata. These complaints affected her daily activities and quality of life. History of present illness. On detailed history, the patient reported that the skin lesions become worse after eating spicy and oily foods. Symptoms also increased after prolonged exposure to sunlight and during periods of mental stress. She had previously used topical creams which gave only temporary relief. The reoccurrence of symptoms indicated that the underlying dosha imbalance had not been corrected. Therefore, a systematic approach through Shodhana therapy was planned. Examination. The patient was examined according to Astasthana Pariksha. The nadi suggested a Pitta Vata predominance. The mala was slightly hard, indicating mild constipation. Mutra was normal. The jiva showed a slight coating, suggesting ama. Sparsha revealed warmth of the skin due to increased Pitta. Overall, the examination supported the diagnosis of Pitta dominant disorder. Diagnosis and treatment plan. Based on the history and examination, the patient was diagnosed as suffering from Pitta Pradhana Tvak Vikara. In modern medicine, it can be compared to chronic inflammatory dermatitis like condition. Since Shodhana therapy was indicated, Virechana Karma was selected as the main treatment. Before performing Virechana, it was essential to carry out proper Purva Karma and therefore Accha Sneha was planned. This ensured proper mobilization of doshas before elimination. Sneha selection. The next step was the selection of the appropriate Sneha. For this patient, Mahatiktaka Gruta was selected. This medicated Gruta is particularly effective in Pitta disorders and skin diseases because of its Tikta Rasa and Pitta pacifying properties. It is also mentioned in Charaka Samhita and Ashtanga Hridaya for the management of Tvak Vikaras. Thus, the Sneha was selected based on the disease, dosha, and classical recommendation. Clinical importance. This case clearly demonstrates that Accha Sneha is not merely the administration of ghee or oil, it is a carefully planned therapeutic procedure that requires proper patient selection, correct Sneha selection, appropriate dosage, and continuous monitoring. When performed correctly, it increases the effectiveness of Shodhana therapy and improves the overall treatment outcome. Therefore, Accha Sneha plays a vital role in the successful management of many diseases, especially those requiring Panchakarma. Now I will move to the scientific basis of Accha Sneha, focusing on the role of bile juice in fat digestion and absorption. Ayurveda has described the therapeutic use of Sneha since ancient times. Today, modern physiology helps us understand how this therapy works. Accha Sneha mainly consists of fats, accounting for nearly 99% of its composition. Since fats are insoluble in water, they cannot be digested directly by digestive enzymes. This is where bile juice plays a crucial role. Bile salts break large fat globules into tiny droplets, a process called emulsification. This increases the surface area of fats and allows pancreatic lipase to digest them more efficiently. Thus, bile is essential for the proper digestion and absorption of Sneha administered during Accha Sneha. Let us now understand the concept of enterohepatic circulation. Bile salts are produced by the liver and stored in the gallbladder. During the digestion, the gallbladder releases bile into the small intestine. After helping in fat digestion, most bile salts are reabsorbed from the ileum and returned to the liver through the portal circulation. This continuous recycling is known as enterohepatic circulation. Normally, only a small amount of new bile salts is synthesized each day because the body efficiently recycles the existing bile salts. This mechanism is important for maintaining efficient fat digestion. Clinical correlation. Now let us correlate this with Accha Sneha. Initially, when small quantities of Sneha are administered, the available bile salts are sufficient for fat digestion. However, as the dose is gradually increased during Arohana Matra, the amount of fat may exceed the available bile salts. As a result, some fat remains undigested and is eliminated in the stool. This condition is known as steatorrhea, which means presence of excess fat in the feces. In clinical practice, this may be observed during higher doses of Sneha and can be confirmed by a fecal fat examination if required. Thus, this modern explanation supports the gradual increase in Sneha dosage described in Ayurveda. Conclusion. To conclude, Accha Sneha is one of the most important Purva Karma procedures in Panchakarma. It prepares the body for Shodhana by mobilizing the doshas from Shaka to Koshtha, making their elimination more effective. Successful Accha Sneha depends upon proper patient selection, appropriate Sneha, correct dosage, careful monitoring of Sneha Jirna Lakshana and Samyak Snigdha Lakshanas, followed by timely Shodhana. Modern concepts of bile metabolism and enterohepatic circulation also provide a scientific understanding of the digestion and absorption of Sneha. Therefore, Accha Sneha serves as an excellent example of how classical Ayurvedic principles can be understood through modern physiology.